So tell me something about deafness in kids and in newborns.
As I told you earlier, surprisingly, 70 to 80% of the causes of newborn hearing loss will be genetic. There is a very significant role of genetics there. And of
Genetic is,
course,
if the family history of deafness,
yes, when
mom,
there is a
dad.
consanguineous marriage.
So consanguineous marriages or marriage between first degree relatives, which you are marrying between a sister's daughter or with mama, that relative, that angle where there is increased risk of, I know that there is increased risk of birth complications. So deafness is one of them.
Yes, it's also one of them. So this consanguineous marriages, as I told you, and a family history of hearing loss, they are all the high risk category. And as I told you earlier, once again, because within the pregnancy itself, 5th month of pregnancy itself, the cochlea is developing. So any kind of infections until 5th month or 6th month of pregnancy, the inner ear is not going to develop maternal infections like torch infections, toxoplasmosis, rubella, cytomegalovirus, herpes in case if mom is getting. The inner ear within the child is not developing. So that is also one of course.
So any infection in the mother during pregnancy.
During pregnancy, maternal infections. And that's the reason we ask them to have a very good healthy pregnancy. And in case if there is healthy pregnancy, but immediately after the birth of the child is not crying because of hypoxia. Hypoxia is the state where enough amount of oxygen is not delivered to the brain and the hearing organ for few minutes. And that also causes hearing loss. And in case all these are okay, but child develops jaundice, neonatal jaundice. Parents very clearly say everything was okay, but child had jaundice. That's why he was kept in NICU for 1 or 2 days. 2 days. After that, everything is okay. But that is a triggering factor because jaundice, when the bilirubin levels are high, they cross the blood-brain barrier. And that affects the hearing organ. So jaundice is the one, apart from genetics, the ones which I have seen for mother who had healthy pregnancy, non-consanguineous marriage. Jaundice is the leading cause for hearing
So
loss.
as a mother, how do we identify that possible deafness in my kid?
This is very, very important for all the expecting mothers and parents to be, because in India, a newborn hearing screening is not happening. Newborn hearing screening is happening in all the developed countries, but it's not happening in our nation because it's a developing country. So it is very important for all the parents to know certain milestones. We call this as hearing milestones. Number one, as soon as the birth of a baby until 0 to 3 months, they start to cry when they get responded to loud sounds. And when a mother or father, they shooses down the kid with their voice, they tend to calm down. This is called startle reflex. This is number one test. Then between 3 to 5 months of age, when we point at a particular sound, some musical toy, they tend to move their eyes this side and that side.
Correct.
That is how this is other milestone. Between 5 months to 7 months, because the head holding capacity, everything comes. Though if there is a music which is playing, they tend to turn their head this side or that side. And from 7th to 12th month or 1 year, they start responding to their name. They start speaking monosyllable words, mamma, atta, amma, all this. By 1 year, they have to get these words. And from 1 year to 15 months of age, if we ask them, where is your nose? They tend to point at that. Get me the car keys. They go and get it. So these are the milestones. From 15 to 2 years of age, 24 months, they start speaking
Correct.
bisyllable words. If these milestones are not met, it is very important for parents to immediately consult an ENT surgeon.